Hi, students. This short instructional video will help you complete the Braden Skin Assessment assignment. I'm going to share my screen for a second so you can see the tool that you will be using. Pressure injury risk screening tools assist in wound prevention as they identify those patients who are at risk for pressure injury development from those who are not. The purpose of identifying those at risk is to guide prevention and treatment. The Braden scale, as you can see here, consists of 6 subscales: sensory perception, moisture, activity, mobility, nutrition, and friction and shear. The individual receives a score between 1 and 4 points for each subscale item. The subscales are then summed for a total score, which ranges from 6 to 23. The lower the total score, the more likely the individual is to develop a pressure injury. The total scores have also been stratified into levels of risk as at risk, moderate risk, high risk, and very high risk. Please remember that the lower the score, the higher the risk of pressure injury. Patients in a long-term care facility should be assessed for pressure injury risk on admission, then weekly for 4 weeks, then quarterly. They should also be assessed upon admission from a hospital and with any significant change in their health status. To use this tool, score every subscale item based on patient presentation. Place each subscale score in the column to the right at the far right of this table. Total the subscores and place the total score designated in the place at the bottom of the table. Next, the nurse completing the assessment will follow the facility protocols to implement prevention and treatment measures according to the identified risk. For your assignment, you will complete a Braden pressure ulcer risk assessment on a patient observed in clinical rotations using this tool. Include the active use of this tool with your assignment submission. On the form, you will identify the pressure injury risk of your selected patient. Next, you will identify 2 pressure injury prevention interventions needed for your selected patient. Lastly, you will discuss if any of these interventions are in place, and if so, are they working? And if not, why not? Please also review the grading rubric to ensure you understand the expectations of this assignment. This assignment should be completed while you are at the clinical site assessing your patient. Contact me if you have any questions. Thank you.